Great. So thank you everyone for being here. Thank you all so much for coming. As I'm sure everybody knows, there have been quite a few changes even just in the last few days in terms of the vaccine distribution in Los Angeles County. So today I have three experts available to kind of help clarify where we are in terms of distribution and what the next steps might be. So I would like to introduce Dr. Krist Azizian. Krist is Chief Pharmacy Officer with Keck Medicine of USC. We also have Felipe Osorno, Executive Administrator of Continuum of Care Operations and Value Improvement with Keck Medicine of USC. Felipe is sort of spearheading the vaccine distribution efforts for the health system. And we also have with us Dr. Richard Dang. Dr. Dang is an Assistant Professor of Clinical Pharmacy with the USC School of Pharmacy. He is also the president-elect of the California Pharmacists Association and chair of their COVID-19 task force. So thank you, everyone. Thank you, gentlemen, for being here. Dr. Azizian, let's start with you. Why don't you provide us with an update of the phase of distribution that we're at with Keck Medicine and who is included in that phase right now?
Sure, good afternoon. So let me just start with some background. We've actually just surpassed our 14,000 dose mark as of yesterday, which we've administered to our healthcare workers and providers, medical, pharmacy, occupational therapy, and physical therapy students. And I believe to date we've administered 35% of those doses are second doses. So we can say that number of people are fully vaccinated. We've essentially vaccinated 65% of our employees and about over 80% of our physician providers. So we're very near the end of our phase 1A and are working very diligently towards establishing availability to those who are 65 and older under the phase 1B plan.
Great. And Felipe, what is the health system's progress vaccinating non-employees, and how is that tracking against our vaccine distribution objectives?
Thank you, Mary. Good afternoon, everyone. So following up on what Dr. Azizian said, we've reached out beyond our employees because we are part of the University of Southern California. So we have medical students, pharmacy, PT/OT students, dental, faculty and staff. So we've vaccinated over 2,400 of these individuals across the university. Last week, we also opened up a drive for healthcare workers who are relatives of our own healthcare workers who might have not had access to the vaccine in other venues. So overall, we've, following the guidance of LADPH, we've expanded beyond our four walls. And to date, we've probably vaccinated 2,600 individuals total who are not employed by Keck Medical Center of USC.
Great. And Dr. Dang, you oversee the vaccine efforts at the Lincoln Park Recreation Point of Dispensing, or to shorten that, the pod, which was actually one of LA County's first vaccine pods for the COVID-19 vaccine. Can you tell us a little bit about how that all got started and where your progress is thus far?
As we were navigating the pandemic last year, we realized that COVID-19 vaccines would be an important toolkit that we would need to have in order to help us bring this pandemic to an end. And so with that in mind, the USC School of Pharmacy began partnering with the City of Los Angeles and the Los Angeles Fire Department last fall to start a pilot program with the influenza vaccine clinics that we provided through mobile and fixed locations. And as a result of those efforts, we delivered over 15,000 flu vaccines to Angelenos in 3 months. Taking that experience, we were able to really quickly bring COVID-19 vaccine pods to Angelenos as soon as the COVID-19 vaccines were authorized and distributed within California. So with that, the City of Los Angeles currently operates 5 vaccine pods, and USC School of Pharmacy is involved in operating the Lincoln Park location, as well as contributing to the Dodger Stadium megapod location.
So can you tell us a little bit about the School of Pharmacy's involvement in the Megapod location and any other sort of university support that we're giving to these county pods?
Yeah, we've had so many partners who have been involved in setting up these vaccine pods. It really took a village to get everything started, from USC School of Pharmacy to the City of Los Angeles Fire Department, CORE, Curative, and Carbon Health. We've also had the support of the university, the medical center, as well as students from the School of Pharmacy, from the physician assistant program, and from our nurse practitioner programs.
So given your sort of on the ground experience at these county pods, what do you think are some of the bigger challenges in distributing vaccines, specifically in LA County?
I think we have to recognize that LA County has well over 10 million residents, and that's a lot of people to try to get vaccinated. So two primary barriers that may be unique to Los Angeles County would be the number of individuals that we have who are trained to vaccinate. So we need as many people to assist with these clinics as possible. It's really an all hands on deck situation. We need any ready and willing individual to volunteer who can work and contribute to these clinics. In addition, we need as many vaccine doses allocated to LA County as possible to help us deliver vaccines to everybody who wants it. We can set up as many pods as we want, but without the vaccines, we won't be able to move quickly.
Now, Felipe, as somebody who's involved in vaccine distribution in a health system, how does this sort of compare with the unique challenges in that setting?
Between trying to vaccinate our own population, which is around 9,000 to 10 million. However, we as healthcare workers were prioritized given our COVID exposure risk. So although the scale is different, some of the challenges are similar. As Dr. Dang mentioned, one of the key things that is weighing on our mind today is supply. We depend on allocations from the county every week, who in turn depend on allocations from the state, who in turn depend on allocations from the federal government. Unfortunately, to this date, it's been a week by week process. So it's been hard to do long range planning without knowing exactly how much vaccine you're going to have, which will dictate how many schedule appointments you can open up. So that's one of the main concerns. I think one of the things that we've been trying to be very diligent about is making sure we follow the guidelines and really try to vaccinate those at the highest risk first. So that's one of the things that we try to ensure, that we went with the highest risk. And now that the county is opening up to those who are 65 and older, that we ensure that we're capturing the right information and targeting those who really need the vaccine at this point. Some of the issues, and of course, depending on what IT system you're using, and Dr. Dang probably can talk about this more, is we need to reach out to patients, schedule them, register them, there's consents, and that's part of the process that we're all trying to streamline to make sure we can increase our speed. That tied with higher supply availability will help us move closer to vaccinating these 10 million residents as quickly as possible.
So with that in mind, Felipe, or maybe Krist can speak to this, what is next for the health system's, I guess, progress in going out to patients and vaccinating more people?
Sure. So I'll speak to that. So there's still healthcare workers to be vaccinated. So that's still our first priority, as although the county has opened to those 65 plus, the data last week showed that across the county, there was close to 400,000 healthcare workers that still were not vaccinated. So we're still pushing internally and doing campaigns to get our vaccination rates higher. And as I mentioned earlier, expanding to other healthcare workers not employed by us. Now that we've opened up as a county to 65 plus, we're focusing on that. So we're standing up our operations in multiple fronts. So of course, we serve over 200,000 patients a year, and about 60,000 of them are over the ages of 65. So we're planning to open up to those patients the first week of February, again, supply dependent. We also have our own staff and employees who are over 65, both at our health sciences campuses and at the University Park campus. So we're also starting to plan on how we can reach out to them. And finally, there's the 65 plus relatives of our own healthcare workers. So we also want to help with access so we can get as many folks vaccinated as possible. So it's switching more towards the patient side. We're still step by step following the guidelines of the county, and we're also trying to increase our capacity so we can vaccinate more people. Maybe Dr. Krist Azizian can talk more about how we're planning to expand our capacity to serve more folks.
Chris, do you want to expand on that a little?
Yeah, sorry.
That's
I had to unmute myself. To expand on what Felipe mentioned, our teams are working diligently to transition to the next phase, which is basically patients 65 and older. We are targeting a February 1 date. Given the numbers that Felipe mentioned, we know that we need to expand to other sites. And so we are looking at standing up a second site near our healthcare facility as soon as February 15, potentially. And then looking at a third site, a larger site, with the ultimate goal, hopefully to be able to do about 1,000 to 1,500 vaccinations a day, to be able to go through all of our patient population that truly needs this vaccine. I'll pause there. We're also, having said that, based on everything we've heard about supply availability, I think one of the primary things we're looking at is how to scale in either direction, right? So we probably will have to scale up slowly and ramp up this process based on supply availability, and then ultimately scale up to be able to, and potentially have to scale down again if, given that this has been a week-to-week process, not knowing how many doses you're going to get the week after, we may need to potentially have to cancel some scheduled appointments based on availability.
So I kind of want to shift the conversation to what patients can expect since this sort of availability for people in the community kind of came upon them so suddenly. So if I am somebody who is in an eligible group to get a vaccine, should I be going to my doctor for that information, or should I just go straight to a county site to try and schedule an appointment?
Yeah, so my recommendation would be that all patients who are eligible for vaccination, they should use all available methodologies possible to schedule their vaccination. I would certainly recommend for those patients who have questions about vaccinations based on their pre-existing conditions to reach out to their provider for consultation prior to scheduling time. But given the scale of people we need to vaccinate at this point in time, I would highly recommend get it where you can.
Good information. And maybe you or Felipe can kind of walk us through what a patient can expect if they're going or planning on getting vaccinated at Keck Medicine. So, how do we go about scheduling? How long does it take? And, is there a cost incurred? That kind of thing.
I can start, Chris, and feel free to add. So we will be starting our outreach campaigns, and we have been updating our patients as, again, the information changes very quickly, as all of you know. So we are starting our outreach campaigns through our portal, through text messages and other means, letting patients know when we'll be available to start scheduling their appointments. Once we do the outreach, we're actually enabling some self-scheduling options similar to what the county sites do, so folks can schedule their appointments, but we will also have phone lines available for those who might need a different route to schedule their appointments. After you get your appointment, there's some pre-screening forms, some consent forms you need to prepare. Then you come to your appointment, we'll take care of you. And upon receiving that first vaccination, we will be scheduling that second appointment. And as you're registered in our system, we'll be sending text and email reminders about your second appointment as well. So I think a lot of hospitals right now are in this holding pattern to launch all this patient outreach. And as I just want to reiterate what Dr. Azizian said, if you can go into these county websites and you want your vaccine today, please do so. I mean, it's both vaccines are great. It's not like hospitals are giving a different vaccine than the pods. So if folks have access today, we encourage them to do so. Dr. Azizian, would you add anything?
I would not actually. That was perfect.
So, Dr. Dang, I imagine that this is a very different process when you are at one of the county pods. So can you perhaps tell us a little bit about what people can expect at that point?
Absolutely. The patient experience for locating a COVID-19 vaccine appointment, as well as finding, and scheduling that appointment really begins at the LA County website at vaccinatelacounty.com. That is the website where individuals can locate county or city-run pods, as well as any medical centers, pharmacies, clinics, or doctor's offices that are currently offering vaccines to members of the public for eligible population. Speaking for the city-run pods, the scheduling links will be found on that website, and individuals who are eligible to receive the vaccine can go online, schedule their appointment, which involves completing some screening questions to determine the eligibility and safety of the vaccine for that individual. They complete several consent forms and receive some communications about the emergency use authorization fact sheets. And then from there, the patients arrive on site and they may encounter two different types of clinic experiences. One is the walk-in, walk-up model, and the second is the drive-through model. Currently with our city-run site, the Dodger Stadium is a drive-through model where you drive in and you stay in your car when you receive your vaccination, while the other sites at Lincoln Park, Hanson Dam, San Fernando Valley, and Crenshaw Christian Center are walk-up models where you'll park and then you'll join a line to receive your vaccine in an outdoor environment. From there, it's a really seamless experience where your information is found in the electronic medical records that you signed up with. We'll be able to locate your appointment, locate your screening questions, complete any clinical screening assessments, get you vaccinated, as well as give you your COVID cards and records of your vaccination so that you know when your next dose is due. Depending on the site, we are trying to vaccinate a lot of people, so there may be lines, and we do appreciate everyone's patience as we try to get through as many people as possible.
Thanks. So it's been pretty widely reported that not even just in LA County, but across the United States, that there are still many people who don't want a COVID vaccine. So how do we address vaccine hesitancy in the community? I guess, Dr. Dang, if you want to start.
There are some people who have concerns about the vaccine because of the various information that they may have heard from their friends, family, or even from the news. I think it's important to engage individuals in conversations to find out what their specific concerns are, whether it has to do about the timeline of approval and authorization, whether it has to do about the safety or the side effects. Whatever their concerns are, I do encourage individuals to have conversations with trusted sources of information, including their doctors, their pharmacists, or other medical professionals. And as a university, we are engaging in those efforts. We are trying to connect with local organizations to facilitate those conversations by hosting webinars and town halls to be able to address individuals' concerns. And overall, the message for anyone who has a concern is that it is a very safe and very effective vaccine. It has been thoroughly studied, no corners have been cut, and the information has been independently reviewed by many scientific communities.
Thank you for that. And Krist or Felipe, did you perhaps want to talk about how we address any sort of vaccine hesitancy among the healthcare worker community specifically?
Yeah, I'll start and then I'll defer to Felipe to provide specific examples of actually his efforts. So I think we now have, and this is internal to our group and to our organizations, we have better information by area and by unit, letting us know percent completion of vaccination, basically. And we've been using that data to provide focused education to our healthcare workers, employees, and providers that work in those areas, answer any questions they may have, answer any questions of their family members that they may have, and basically to encourage vaccination. And then furthermore, as you know, Mary, our marketing team has done a fabulous job at basically capturing various individuals, frontline healthcare workers' journeys as they go through the first dose and the second dose, and having them basically talk through their experiences, why they decided to take it, and then really making that information socially available to both internally as well as externally placing platforms. And so I do want Felipe to share his specific efforts, one of which he actually completed today, that kind of speaks to that.
Thank you, Krist. So we noted, although our overall vaccination rate among our employees is about 65%, we noted that certain areas have much lower vaccination rates. And one of these groups was our environmental services team, where the vaccination rate is about 40%. And this is not dissimilar to what we're seeing throughout the country, that Latinx and people of color communities are getting vaccinated at much lower rates. So we started a campaign that we launched yesterday, actually, and as we open up vaccination to those over 65, we actually did a specific outreach to our environmental services employees so they can come this weekend with family members over 65 to get vaccinated. This has been received extremely well. Because again, a lot of folks in these communities live in multi-generational families. This is where we've seen very high numbers of COVID infections and mortality. So we wanted to make sure that we started our outreach that was more specific to those who are very vulnerable. In addition, one of the things we've learned, and of course we are in front of media experts, is just putting out emails and electronic communication is not enough. So I've actually been meeting in person with a lot of our environmental services staff to address their questions in Spanish and in English. We've created posters with QR codes so people don't have to go through an email, really to eliminate a lot of the barriers to access. And once you have a chance to answer questions in person, usually a lot of folks feel a lot more comfortable. And I know there's, as Dr. Dang mentioned, many resources online. A lot of these resources available online are not really in language that a lot of folks can easily understand. So I think eliminating those barriers from health literacy, et cetera, is important. So we're excited about our campaign for this weekend, where we will be able to take care of the 65 plus family members of our environmental services team.
Thank you so much. That's actually, congratulations on launching that. That's fantastic news. And I think for any of our webinar or press briefing participants, as Felipe mentioned, he does speak Spanish. So if you have any follow-up needs for a Spanish language speaker, do feel free to reach out to any of our media team members. Our contact information is at news.keckmedicine.org. Contacting any one of us, we're happy to help. So I think at this point, we can go ahead and start taking questions. There is a Q&A feature at the bottom of the screen, hopefully, and we'll try our best to get through as many of the questions as we can. If that's not possible, we will do, again, our best to follow up with people individually. And again, just reiterating, if you do have any follow-up needs that aren't addressed by this conference, do feel free to reach out, news.keckmedicine.org. So with that, I guess, do we have any questions that are coming in?
Yes, we have one. How many vaccine doses do you currently have available?
Yep, so I'll take that. As of yesterday, we essentially have 5,000 vaccine doses on hand, with about 3,000 between now and end of next week scheduled to be administered. So I think that'll provide a pretty good picture of how narrow our margins are in trying to plan ahead.
Chris, if I might add to that, I just want to mention that we did not receive any new allocation this week. We have requested for next week, but we have not received confirmation. So even though 5,000 might sound like a lot out there, it's actually only will last us a week. And if we don't get more, it'll inhibit our ability to keep on moving with the 65 plus.
For the city-run sites, I would encourage you to reach out to the Los Angeles Fire Department for the exact numbers and updates. But what I do know is recently, we currently have about 70,000 vaccines on hand for all of our pod sites, and we do receive weekly allocations from the county.
Great. Next question is, how close is the Dodger Stadium pod to the 12,000 daily goal, and what can be done to get closer?
We are very quickly ramping up our daily capacity at the Dodger Stadium. As many individuals on this call know, we launched on Friday, and we are currently at 8,000 to 10,000 capacity, and we hope to reach the 12,000 capacity by the end of the week. What would help us ramp up much more quickly is, again, as many people as possible to help us staff the events, both clinicians and non-clinicians, and more doses coming in through the allocations.
Great, thank you. Next question, is there a concern that second doses will not be available in time for the recommended guidelines?
I can start and then Felipe can add, but at this time, we don't have concerns so much about second doses as I think the county is truly trying to prioritize the need for second doses and allocations for second doses. Our concern is primarily with first doses being available, given the limited number of allocation.
I have nothing to add.
Okay, thank you. How many people total have been vaccinated?
I can take this first. At the city-run vaccine pod locations, through all of our efforts across all locations, we have vaccinated over 83,000 individuals.
And I can speak for Keck Medicine of USC, and this includes both of the hospital-based and campus-based operations for all healthcare workers. We have administered over 14,000 doses, as Dr. Azizian mentioned earlier. 9,500 of those are first doses we've administered, and 4,600 is folks who have already received their second dose.
I think we have time for just one more question. And like I said, we will try our best to follow up with everybody individually.
Great. In what category phase will patients with underlying conditions be a part of? Is it after the 65 plus and older people, or in that same phase?
I can clarify this when then Drs. Azizian or Dang. So at this moment, we're focusing only in phase 1B, tier 1 of those over 65. I believe that those with underlying medical conditions under the age of 65 are in a subsequent tier within phase 1B. So we're not quite there yet. I think it's the next phase. As Dr. Dang mentioned, we have 10 million residents in the county, of which 1.5 million are over the age of 65. So it's a big group to vaccinate. It's unclear, and as we've all mentioned, the factors, staffing availability, vaccine availability, will tell us when we can move to patients under that age with underlying medical conditions. I don't know if my colleagues have anything to add to that.
I can add on. The phases are being determined at the state level, and there are various committees and task forces that have been assembled by CDPH and the governor to have those discussions, and they're actively still making decisions to provide guidance to the local jurisdictions. As we know, phase 1A included healthcare workers and residents of long-term care skilled nursing facilities, and we've now added on 65 and older as the beginning of phase 1B. The next groups to anticipate to receive allocations would be frontline essential workers. And then after that, that would include any adults under 65 with high-risk conditions. But as more information comes in, the state continues to evaluate the status, and they will provide the guidance to the local jurisdictions as far as when and how to open up the next phases.
Well, thank you all so much. This has been a very helpful press briefing for me and I'm sure for everybody else. And a recording of this briefing will be distributed via email later on this afternoon, and we will also post this on our newsroom at news.keckmedicine.org. So I just want to thank our speakers, Dr. Dang, Dr. Azizian, and Felipe for being here, and for all of you for attending. Excellent. And so until next time, bye.
Thank you.
Thank you.